And I suppose in moving the bill, I did think that today was going to be a bit of a showcase to display not just the worst of what's happening in our prisons, but some of the best, as we had planned this morning, to have a number of currently serving and former inmates to make a presentation in the Dáil, along with their partners, the staff in the Irish Prison Service, about the community healthcare programme run by the Red Cross and the wonderful that programme is about rehabilitative measures in our prison service. But unfortunately, that didn't happen this morning. I mention it for two reasons. One, that I know that the staff and the inmates were incredibly disappointed, and to publicly put on the record that we are determined and hope, in cooperation with everybody, to reorganise that event in January. But also, I think, to register that when we talk about the shortcomings in prison policy, such as the one that this bill seeks to address, it doesn't mean that we are unaware of the excellent work being undertaken in some sections of our prison service by both staff, inmates, management, professional staff and so on. And I think I want to start by stepping back a bit and looking at where are we going with our penal policy. Is it working? Every day we have thousands of men and women, staff, inmates, professional staff, cleaning staff, locked behind a bubble and the walls of our prison service at huge cost, an area that's rarely discussed, except in the sensationalist manner by the gutter press. And we have to say, what's it all about, and is it working? Because we know from the Whittaker report, for example, that prison is not a major or universal deterrent to crime. We know from multiple reports that prison harms people emotionally, in many cases physically. We know it has a major impact on families and communities, actually deepens exclusion. And we know that it actually increases the chances of people staying involved in a life of crime. I think we also know from the excellent report done by the Jesuit Centre for Justice and Faith this year, Developing Inside, gives an analysis of who is in our prisons. And, you know, even though the data is somewhat old and varied across different times, we can say that 52% of our prison population comes from ex-homeless people, 20.3% had no education or only primary school education, 88% of people were unemployed, 93% came from the two lowest socio-economic groups, 90% had mental health issues, 28.8% indicator learning disabilities, and 18.5% had an alcohol dependency. And all of the people were victims of crime themselves. The list goes on. And the point I'm trying to make is, what is the point in taking these people out of society for a couple of years and dumping them back out? Prison, if it's to mean anything, has to be an opportunity to deal with some of the many complex issues, be it drugs, behavioural problems, other problems that got people in there in the first place. Otherwise, it's an absolute waste of time, and it undermines the efforts of the staff in the prison service, who are doing their best against the odds. And I'd have to say that our prison service falls well short in terms of the lack of support for drug treatment, for mental health training, education facilities and so on, and with the effect that people are being sent back out in pretty much the same way that they came in, if not more damaged than they were beforehand. And that's very bad for the staff, it's very bad for society, and it's obviously very bad for the inmates themselves, because our penal policy and our starting point has to be that people should be sent to prison as punishment, not for punishment. And that is our prison policy. It's supposed to be. The deprivation of liberty is the price that somebody pays, and once they're there, the time should be used to try and rehabilitate that person back into being a productive member of society. And that approach, which has been taken in other jurisdictions, such as Finland, for example, has massively reduced the prison population there. And it's against that backdrop, really, that I am moving the bill today, which sets about severely curtailing the use of solitary confinement. Now, let's be clear. Obviously, my belief is that solitary confinement should be outlawed entirely. That's my personal belief. But in the interests of getting this bill passed and to help the people who are in that situation now, as we sit here in this nice, comfortable chamber, whose human rights are being violated, in some cases for months, in some cases for years. I'm putting forward this bill in the hope that that will, in the manner in which I do, in order to assist in getting it passed, because I'm taking the definition which comes from the international human rights standards around this issue. And to be honest with you, they're pathetically limited, but they will, and if passed, would make a difference for people in that situation. Now, the first thing that the bill does is to bring into Irish law for the first time a definition of solitary confinement. And this is very important because we don't have the data, and because every time we ask, the answer the Minister will give is we don't have any solitary confinement in Ireland. Yet we know from statistics taken, for example, in April on one of the days there were 368 people, or 9% of the prison population, on restricted regimes. So you can call it what you like: restricted regimes, violently disruptive prisoner policy, isolation, segregation. They are all versions of the same thing. Now, when we've raised this issue before, and the bill itself centres on lock-up and solitary confinement for 22 to 24 hours, the Minister in previous replies has pointed out that the numbers are declining. And that is true. The numbers being held in those conditions is declining, and that is a tribute to the work being done by the Irish Prison Service. However, I would point out that the reductions are not consistent. It depends on what figures you compare. For example, if you compare 2013 to 2016, they're going down, but if you compare 2014 to 2016, they're going up. And the key point of this bill is that it needs to be put into law, because there's nothing to stop them going up in future. Now, the bill amends Section 35 of the 2007 Act, which is the one which allows the Minister to make rules to govern and regulate prisons. It's under present prison rules 62 and 63 that are made under this section that the present system of solitary confinement is allowed for, and this bill seeks to put restrictions on that practice. The definition is the restriction of a prisoner's opportunities for meaningful human interaction and communal association for 22 to 24 hours a day, whether by means of restricting the prisoner to a cell or by any other means. And the reason and the importance for that, we've used the definition that loosely followed the UN's revised standard minimum rules for the treatment of prisoners, the Nelson Mandela rules as they're known. The only qualification or addition is that we've added in the meaningful human interaction and communal association, because it's not about just restricting somebody to a physical space. When we've made this point about prisoners who are in that situation now, the Minister has said, oh, should they get out? They can go to the gym, they can go out into the yard. The point is they're being denied any human contact, and that is incredibly dangerous. And this bill restricts that to a maximum of 15 days. We know, and the evidence is very, very clear, that any solitary confinement beyond that period is profoundly damaging. It's been deemed to be inducing a psychiatric disorder characterised by hypersensitivity to external stimuli, hallucinations, panic attacks, cognitive deficits, obsessive thinking, paranoia, and a litany of other physical and psychological problems. Assessments on men in solitary confinement indicate high rates of anxiety, nervousness, obsession, violent fantasies, nightmares, trouble sleeping, perspiring hands and heart palpitations. And this bill, I'm not going to repeat it, but puts in a severe number of restrictions in the amount of time and manner in which people can be isolated. It puts the huge onus back on the prison manager, because the purpose of this bill is to put an end to a human rights violation that is taking place today. It is in actual fact state-sponsored torture, in some instances, what we are putting some people through. And the restrictions being outlined in the bill, the deputies have read them, I'm not going to repeat them, puts the onus back on the authorities to find alternatives. And I think it's really relevant, because Ireland is before the United Nations in July, and we have to answer for our efforts, or lack of efforts, in this regard when we go there. Now, when this issue has been raised by us before, it's justified by the prison authorities and by the Minister under a number of criteria, mainly those outlined under Rules 63, 62, 64 and 67 of prison regulations, where we're told that people are put in solitary confinement either at their own request or at the request of prison authorities, we'll say, for their own safety or for the safety of others. Other reasons for the good order of the prison, for medical reasons and for disciplinary reasons. Now, our bill outlaws it with anybody with mental health problems and as a disciplinary mechanism. Under the present regime, depending on the circumstances, there's no limit to the times that are there that somebody can be kept. And that is simply not on. It's a human rights violation. Now, let's be clear about it, lest there's any doubt. Prison officers are entitled to a safe working environment. Last year, there were almost 100 prison officers injured at work. Now, thankfully, we've never had the death of a prison officer in the history of the state. We have had the death of prisoners at the hands of other prisoners, and the prison can be a violent place. I know there are at least 2 prison officers who have been permanently incapacitated because of what happened to them at work, and that simply isn't on. And when we talk about the rights of prisoners, that doesn't mean we're blind to the rights of prison officers. All rights have to be respected. But the reality is that putting people in solitary confinement does not make prisons safer for those people, for the people who work with them on a daily basis, or for the people in society to whom those people will be returned after a very, very short period of time. And we should be clear that there are a number of people in our prisons now, for example, with serious mental health problems. And there's an overlap here, because one of the causes is the lack of psychiatric beds in the community. We know that the prison services have had to release people back out, drop them at hospital A&Es and say, don't leave here until you get a psychiatric bed. Under the violently disruptive prison policy and the arrangement with the Central Mental Hospital, only 1 prisoner is taken by the Central Mental Hospital at a time, leaving other people there, prison staff who are unqualified and unequipped to deal with them there. There are a number of acutely psychotic people in our prison services who should not be there. But solitary confinement is not the answer, and we know from prison officers that some people have been put in there either at their own request or for their own protection, allegedly, and they've come out caught being violent and paranoid and worse than they were either. So these issues need to be tackled, and what our bill is put the onus back on the prison service to come up with an alternative. And I don't blame the prison service. The people who have to come up with an alternative is actually us in here and the government, because I actually think the prison service are doing pretty well given the lack of resources that are there. But if we don't address this, we're not just violating the human rights of prisoners, we're broadly more seriously impacting on broader society as well. And I just want to end maybe by dealing with a case of a young man that we have been in contact with. We've met many prisoners over our time of being elected to the Dáil, along with our colleagues in the cross-party group. But one young man where we became involved in his case had an incredibly troubled upbringing, grave parental neglect, brought into state care, seriously let down by the state from the age of 4, serious abuse, homelessness as a young teen, really incarcerated the majority of his adult life, and the majority of that time spent in solitary confinement, where he's had no contact with other prisoners, limited access to education and a profound effect on his life. And I just maybe want to finish by it's obviously serious stuff, but what we're doing to people is very serious and it has consequences. And I just want to finish maybe with his words, because I asked him to say, what does being in solitary confinement mean to you? And he said, I'm currently being held in solitary confinement for the last 3.5 years. It has such an effect on me. My whole life has changed. I can't even mix with people without being overwhelmed. I get extremely paranoid. When you spend so much time on your own, you become disconnected from reality. You find when meeting people here and there too much, your anxiety is through the roof. always looking for threats that aren't there. It's like being stranded on an island on your own. No one is there. No one to say, "How are you today?" because there's no one there to answer you back. It's so lonely. Even if you were the hardest person on the planet, you would crumble in solitary confinement. I wish I wasn't in isolation. It has ruined my life as far as mixing is concerned. I don't think I've done anything to be treated like this. If only the powers that be could walk in my shoes for a day, a week, a month, a year. What do they want from me or from any other prisoner in isolation? To take away basic human rights, it is immoral. What we have to put up with will continue if things don't change. Days are so long. How much more do we have to endure? I am a human, not a dog, and if we treat people like animals, they will behave like animals. Respecting the human rights of some of the people who would be considered amongst the most lowly in society means vindicating the human rights of all.